Early identification of a child's vision problem can be crucial because often children are more responsive to treatment when they're diagnosed early. Dr. Angela Buffenn discusses the importance of eye exams for children.
Well, oftentimes the child is first examined by the pediatrician, and if there's any suspicion of difficulty with vision or ocular misalignment, then the parent is referred to a pediatric ophthalmologist. But in general, it's good to have the child, if you have any questions at all, it's not unreasonable for a parent to bring their child in to a pediatric ophthalmologist at about 2 years of age. Of course, if they have questions before 2 years of age, you should bring your child in as soon as you have any concerns. But if you have no concerns and you just want your child examined, 2 to 3 years of age is appropriate. We have several tools that we can use to diagnose, to assess vision without using the eye chart. And this can even apply to adults that have dementia or just unable to participate in an eye exam. So we use a lot of toys, a lot of bright colors, things that attract children's attention. And it's very common where a child won't even realize they're undergoing an eye exam. It seems very simplistic sometimes to parents when you're sitting there with a toy and moving the toy up and down and the child's reaching for it. But the exam really starts from the time I walk in the room until the child leaves, basically. There's a very well-known technique called dynamic retinoscopy that is used by nearly all ophthalmologists, even in adults, and you use a light reflex that shines from the child's eye to the examiner's instrument. And depending on the direction and movement of the light reflex, I can actually calculate what the prescription should be. So if a child has a severe need for glasses and they've never received those glasses and the child is 3 or 4 years old, they don't really have a way to tell their parents things are blurry because that's all that they know. Everything's blurry, they think that's normal. So it's not until they get their corrective lenses that they're able to say, oh, actually there's a lot going on in the world. I saw a little girl a few months ago now who was incredibly nearsighted, meaning she could see things up close but really couldn't focus on much far away. Couldn't focus on much beyond 2 or 3 feet away, to be exact. And her mom, her parents, didn't realize this. So I checked her prescription, and she had a very high prescription by all standards. Gave her the prescription for glasses, and when the mother took her to the optical shop to get her glasses, the optician thought the prescription was way too high and just thought this can't possibly be right. And I had warned this child's parents of this. But so he called me. I explained to the optician, yes, this is right. Go ahead and fill the prescription. When they put the glasses on the little girl, she looked at her mommy and she said, "Mommy, I can see you." And her mom started crying. So it can make a big difference.